Yeah, hi, it's Graham Healy here, and what I've decided to do is just do a group video for those who have contacted me on the dry needling advertisements. Um, I've sent emails to most of you, and some of you have sent me back, you know, um, sort of inquiries, and I'll just explain to you what the procedure is. So, with the dry needling, the way I do dry needling is different from anyone else normally, especially those who haven't been trained by Dr. Wayne Mamu, as I have, to the master level. Now, just to answer a few generic questions, I get, well, so far I've had sort of miscellaneous questions like, oh, I've got sciatica issues. I've got, something wrong with the back or whatever. So one lady said the knee, and I'll just explain a couple of things to you. So each particular case, I've got to look at what I'd call the kinetic chain up from the particular problem. Say, for instance, it's the knee. Quite often, more likely than not, it can be the quadricep group further up the leg, which is giving you most of the problems because the knee is attached via tendons to the whole quadricep group. So you've got the vastus medialis, the vastus lateralis, and the vastus intermedialis, and the uh, the whole group there, including, no, that's about the cover of it there. But say, for instance, we look at, sorry, back to the knee. There can be problems underneath the knee. There can be problems around the knee. But really, what we've got to do is diagnose it correctly first. So, just giving a like an answer on the Facebook advertising, there isn't a one answer to a problem which may have a whole lot of root causes. Now, for instance, someone said to me they've got sciatica nerve issues. Now, that's a big subject because the sciatica nerve has its roots from L4, 5, and S1, 2, 3 into the coccyx as well. So there's like the sciatica nerve's got roots on it like this. So it could be one of those particular outlets or root. Yes, the root outlet's the best way to describe it. That could be impinged, and then of course it goes right down the whole nerve, and the sciatica nerve is quite a big cable that goes down the back of your leg. So it could be, I mean, certainly dry needling can help, but it may be that you have something like, for instance, you may have an impingement in the lower back that's causing that. So all I'm saying with this video is that the best way for me to determine how I can help you is to have more of a chat. The best is to give me a call, really, and have a bit of a chat so I can expand upon the diagnosis, because I need to have a look at what the referral patterns are. I need to have a look at what your background history is. Have you had any sports injuries? Have you had any operations? Have you had any, surgeries on a particular, like the lower back or anything like that? And then we can do a scenario. So normally, just to give you an idea, normally what I would do is I have a look at the full picture, because if you don't look at the full picture, you can't do the um, one hit solutions don't work. They might work a little bit in that area, but for instance, I'll give you another example. When I had a rotator cuff issue in my shoulder, this is probably about 15 years ago. I couldn't lift that shoulder above about there, so it wouldn't go up further. Now, at that time I was, I had my personal training qualifications, what have you. It's a fair while ago, so I've now got medical qualifications as well. But it was there was an issue with the group of rotator cuff muscles around the shoulder blade, right? And I tried everything, all the known exercises and the known therapies at the time. None of it worked. Absolutely zero. And then one associate of mine who used to be a really good massage therapist. I think he was a massage therapist for the Broncos and a couple of the other football teams in Brisbane. And I contacted him and I said, mate, do you know what you can do for rotator cuff shoulder problems like frozen shoulder? He said, mate, I've got a girl who can do dry needling. Now, I never heard of dry needling before. I had acupuncture and all that, but acupuncture is working on a different sort of system. It isn't as deep as dry needling. Anyway, I said to him, well, how long would this take? He said, quite often it's fixed in one treatment. I couldn't believe it. I had this problem for 6 months. So I went along. I can't remember the girl's name now, but obviously she more than likely was trained by Dr. Wayne Marmo, I would say. Well, she proceeded to do the dry needling treatment all around the shoulder blade. And I was in that surgery basically for an hour. So the needles are in for a long period of time, is exactly how I do them. And I walked out of there and I thought, I wonder if this works. Well, that was well over 15 years ago. The injury never came back, and I only had one treatment. So what I'm saying to you, and when I did go to university, just finished the med science degree after 6 years of university studies, the various lecturers in there, when I mentioned dry needling to them, they, some of them, because they had not personal experience, just said, oh, yeah, it's another modality. But the reality is it's probably the number one modality. So in summary, I'll just summarize this off. When you've contacted me through the ads, I've got to do a deeper diagnosis. That's what it boils down to. So that's what any good practitioner will do. They don't just do one-hit fixes. And when I have a look at the diagnosis, the history, your medical history, the history of your injury, how it occurred, when it occurred, how long you've had it, and all this, is it chronic or acute, and all this sort of thing, then we can work it out. Now, you can have pain in various areas, and where the pain is totally unrelated to the origin of the actual area. I'll give you an example of this. Just I'm leaning over here to get my muscle manual book by Dr. Nicola Vizenak, who's a mate of mine in Canada. And I'll just give you a little bit of an idea, a bit of a concept, what we're talking about here. Okay, so now let's just pick on a muscle. Any muscle will do. Okay, let's have a look at, all right, the vastus lateralis, or the quadricep muscle on the outside of your leg. So here it is here, if you can see it there, right? And there, here, if you can see that, that's a referral pattern. So as you can see here, you may have pain down to the lateral side of your knee. It's actually the whole muscle that's causing that. It could be just a spot right here. It could be referring right through the whole side of the vastus lateralis, and so on. And when you have a look at, for instance, the rotator cuff muscles, and we'll get to that. Let's have a look now. Oh, yeah, okay, here's a good one. You know, people say they've got sciatica issues. Now, the question always is it radiating or is it local pain? So here's the piriformis muscle, right? If you can see that, right? At the, basically just above the coccyx, and it goes to the greater trochanter of the femur. And then when you look at the referral pattern, which is here, you can see it goes from the glute, can go right down the back of the leg, right? So you can be feeling pain in one spot, and the origin of that pain is a completely different area. Now, when I go to the rotator cuff, the issue I had, and I'll just show you the issue I had, was the supraspinatus, right? You can have a look at that there, right? Supraspinatus actually lifts the humeral bone outwards. Then the referral, have a look at the referral, can be all the way down to almost to your thumb along the forearm. And where I found it was really a lot of pain just at the back of the tricep. Right. So, you know, again, these manuals, I've got 25 of them. And that's from Dr. Nicola Vizenak, who's one of my associates. And I'll have the permission to use all of his material in advertising and what have you. He's a top guy in Canada, top doctor in Canada. He's just a little bit of a shout out with Dr. Vizenak. He's a martial arts instructor as well, and he's probably one of the best. He's a chiropractor, he's a naturopath, he's an acupuncturist, he's a natural medicine guy, and in Canada seems to produce a lot of good medical people over there with either chiropractic or natural therapies. Dr. Vizenak is also teaches many of the medical doctors, the surgeons, anatomy, dissections, and all this sort of stuff. He's sort of right into that side of the equation. Very good guy, very, very intelligent. He's written about 25 books, and I think he's only about, wouldn't even be 50 yet. So very intelligent person. I've learned a lot of Dr. Vizenak, actually. Have all these material and refer to it quite frequently. Okay, that's Graham Healy over and out. The takeout from this is that you can have referring pain, and it can be totally unrelated to the spot where you think it's coming from. You think it's down like I did. The supraspinatus sits right across the shoulder blade, and I had a very sore tricep, and I was massaging the tricep, doing all sorts of things. I thought, oh, it's a big tricep, the top of the shoulder. Had nothing to do with that. It was the origin of that particular pain was the supraspinatus. Now, when you get into the dry needling part of it, you have a lot of people doing what I call surface dry needling. And that's, you know, the key with dry needling, the way Dr. Marmu has taught me, you leave the needles in a lot longer than most people do. Most people sort of do dry needling. It's like they do it like a quick fix. Oh yeah, we learnt this, dunk dunk, and they just put the needle in and out. However, that's not how I do it. How I do it to get the success that I've got is I'll put the needle into the trigger point, and then I'll do a level 1 to 5 or a level 6, and I'll explain that to you later. And usually the needles are in there. When I'm doing my own dry needle myself, I leave the needles in for at least 30 minutes, sometimes 40 minutes, and the effect is far superior. Because when you look at it, we're actually doing a medical intervention into the trigger point. So the trigger point, it looks like a little pea. Just imagine a little the actin and myosin contracted into a little pea area about the size of your fingernail. And then the needle, thin as it is, will go through that, and then you'll have capillary blood flow into that, and it'll release the actual muscles as well. So it's far more effective than using a polo cross ball or a tennis ball or some roll on something. Now, just imagine this. I'll leave you with this. Just imagine that you had on the skin surface, this is totally unrelated to dry needling, but just it's a good parallel. Just imagine you had a boil on your leg. Now, you can imagine if you put broad pressure on that boil, it will hurt like hell, right? That's what most people are doing when they're trying to treat trigger points. They're either putting thumb pressure on the area, which will hurt like hell, or some even use their elbows. I mean, I've had one guy use an elbow on me, and I said to him, I said, back off, or you'll be sorry. It's extremely painful. So the big advantage of using acupuncture needles in dry needling to trigger points is you can hardly even feel it. And the results are fantastic. Now, in the bigger picture, I also do mobilizations. I've got massage machines as well. I've got quite a strong massage machine which can relax the muscle. And I've got the activators and et cetera, et cetera. So there's a whole procedure, or the IASTM tools, which are Dr. Vizanak's designed massage tools, which get deep into the tissue. So not only do we do the dry needling, but I also look at muscle relaxation to be associated with that. That can be before or after the needling. Sometimes I'll look at what modality, and sometimes I'll combine all the modalities together. Okay, Graham Healy over and out. Hope this video helps. And so the next step from contacting me on the Facebook advertising is really to make an appointment. And, you know, just think about this. Most people that come to me, they've been to everyone else. Quite frankly, when I had offices at a health centre in Brisbane opposite PA Hospital, everyone that came to me for treatment and advice had been being so-called treated for years with other practitioners. I'll just give you one example. One girl came to me and I went through the procedure, you know, the range of motion, all this sort of stuff. And she had a crook back, right? And I said to her, well, what have you been doing? And she went to the what I call the regular practitioner, and she was going there for 5 years or something. And I said, well, whatever they did it work? And she said, no, it just didn't work. I said, well, why did you keep going there? She said she had no alternative. We did a diagnosis with an associate of mine at the time. I had a Chinese acupuncturist working with me, and I also had another doctor of chiropractic that I used to work with then. This is going back 10 years ago. We did a diagnosis on that, solved the problem immediately. I mean, she was fixed and mobile, out of pain within, I think it was 2 to 3 weeks. And she'd been going to the other practitioners for 5 years. So, you know, as I say on the website I've done, we are the last port of call. And why we are the last port of call? Because we're out of the system. We're not in the system. We're out of the system. And why I'm out of the system is I know how the system works. Remember, I've done 6 years of med science. I've had to deal with all these characters. So Graham Healy over and out. I think you know what I mean. The bottom line is, with any treatment, if you haven't got immediate relief, and I would say in the area of 80 to 90% from the first session, obviously the practitioner obviously needs more training, right? Let's leave it at that. Okay, Graham Healy over now. Don't forget, just make an appointment. And, you know, all my appointments are an hour long. So we don't, sometimes it goes a bit longer if it's your initial appointment. And we do a very, very careful diagnosis. Now, remember, if you have any x-rays or you have any previous diagnosis from the radiologist, bring that paperwork along or email it to me at healyshealth@hotmail.com. Okay, Graham Healy over and out, and I hope to see you soon. Thanks very much.